Coming up, a cancer patient hopes to shine the light of knowledge for others with a new ad campaign and a unique foundation.
I found a need to start this because I felt so alone.
Here at Your Total Health, we talk a lot about cancer, the risks, the treatments, and what it's like to live with. Well, every once in a while, we come across a story that is both important and uplifting, like this next one, about a woman who's been living with cancer for more than 10 years. The cancer she's fighting is becoming more and more common, and she's doing all she can to make sure everyone knows more about it.
For cancer patients like Joan Shea, life can be divided into two stages: before diagnosis and after. For Joan, that split came in 1995 with the diagnosis of thyroid cancer.
I had never heard of thyroid cancer, and I'm reluctant to say I didn't even know what a thyroid was.
Fast forward 10 years, and Joan is now a force in the field of thyroid cancer. She's the founder of the Light of Life Foundation, the nonprofit group behind these polished ads that have been popping up in so many magazines lately. The foundation was Joan's way of creating community in the face of an illness that can be so isolating, both literally and figuratively.
I found a need to start this because I felt so alone. Because of my diagnosis and knowing that I wasn't going to be cured overnight.
Joan was diagnosed with advanced thyroid cancer. It began in her thyroid, the gland in the neck that makes hormones which help control the body's heart rate, temperature, and energy level. And from there, spread to her lymph nodes and lungs.
I was 42 years old. I had 2 young teenage children. I was very active. I never complained of feeling sick in any way.
At Memorial Sloan Kettering Cancer Center in New York City, doctors removed Joan's thyroid and almost 40 lymph nodes in her neck. Next came the first of many rounds of what's called radioactive iodine treatment, swallowing a radioactive substance to kill the cancer in her lungs. Patients are required to go into isolation for days at a time.
It was lonely. The first time it was really scary because I wasn't prepared to even know what it would be like to be in isolation. So you have the TV, and you have your thoughts,
To lift her spirits, Joan's teenage son gave her an amusing gift, a light-up toy to keep her company during her treatments.
He came home with this glowworm, and he squeezed it, and it glowed, and he said, "Mom," he said, "it's like you, it's glowing in the dark."
Joan brought the glowworm to the hospital and showed it to her doctor.
And he said, "Joan, the light within heals." And I thought to myself, he got it. And then when I told him I wanted every patient to get it as well, he looked at me and he said, "I'll help you."
So in the spring of 1997, with the help of Memorial Sloan Kettering, Joan created the Light of Life Foundation, which started out small, handing out gift baskets that include information about the disease, books to pass the time in isolation, plus the signature glowworm.
It was a token of, you're not alone, there's someone else who understands.
The foundation also started a support group and began raising money for research. And it's getting the word out with the public awareness campaign developed pro bono by the Low Worldwide Advertising Agency.
The fastest growing cancer among women is not what you think.
The women's ads came first, and now this year, the men's campaign.
Something inside you may want you dead. Ask your doctor to check your neck for thyroid cancer.
As for Joan, she's not technically cancer-free, but she is feeling well and is monitored regularly by her doctors. She is a proud grandmother now with a simple message.
Just having your neck checked can really save your life.
Joining us now is Dr. Michael Tuttle of Memorial Sloan Kettering Cancer Center, who treats Joan. Thanks so much for joining us, Dr. Tuttle.
Thank you very much.
I was surprised to learn that thyroid cancer is the fastest growing cancer among women, and it's increasingly fatal among men. Who is at the most risk?
You know, that's the hard part. Basically, any lady is at risk for thyroid cancer because we don't really know why people get thyroid cancer. So there's no real risk factors. This is not smoking, it's not radiation. So the message is that every lady, and every man for that matter, needs to have their thyroid examined as part of their routine health care.
Now, is this a genetic type of cancer?
There are some forms of thyroid cancer that are genetic. Fortunately, those are very rare forms, and that's not what the type Joan has. So most of the time, this is not genetic. It tends to happen in just one member of the family.
I guess the good news about thyroid cancer is it is 90% curable if you catch it early. And the idea is to catch it early. So if you're an average Joe and you're not sure if you may have this, what should you look out for?
The best thing to look out for is actually visiting a physician or a healthcare provider, because most people with thyroid cancer are like Joan. They don't feel it. They don't have any symptoms. There's nothing to tell you to go warn. It really is one of those things that we find on a physical exam that should just be normal part of the process.
So the idea, if you feel around in your thyroid area, you could actually maybe feel a nodule or something?
Yeah, you can, but I've spent sort of 25 years trying to figure out what's normal in the neck and what's a thyroid nodule.
Right.
Most of the time when people feel something funny in their neck, it's really their voice box or their windpipe.
So you should ask your doctor to specifically check for thyroid cancer.
That really is the key.
Now, what other physical symptoms may you have if something's amiss with your thyroid?
Yeah, the thyroid sort of has two main things. One is it can get overactive or underactive, and that's what we typically think about with thyroid, with people gaining weight or being anxious and nervous. In thyroid cancer, you hardly have any of that at all, because this is a structural problem. It's just a lump in the thyroid.
So in order to get rid of this cancer, usually do you have to remove the thyroid outright?
Yes. What we do is everybody always wants us to take out just the lump of thyroid cancer, but technically that's not very easy to do.
And you can still live a normal life
You do.
without your thyroid?
We take the thyroid out, but then we replace it with thyroid hormone pills, which is 1 pill a day that you take.
And it was interesting that there's no chemotherapy with this type of cancer, is there?
That's absolutely right, and that's a key message that I'll frequently tell people the first time they see me. Thyroid cancer is largely a surgical disease. And if we have the surgeons take it all out of there, we're largely done. If we're a little more worried, then we can use some radioactive iodine.
So the message that you have for folks is tell your doctors to check your neck area.
Absolutely. Get it on their radar screen. They're busy. When you go see your doctor, you're talking about 13 different things, and the last thing they think about is a thyroid nodule in a perfectly healthy 40-year-old mom.
Right.
But if you just raise the issue and ask the question, in 30 seconds they can feel the thyroid and find these nodules early on.
Dr. Tuttle, thank you so much for joining us. We appreciate it.
Thanks very much.
And up next, comedian Howie Mandel shares his health secrets.